Welcome back, everyone. Today, we're taking a fascinating journey deep inside the body's hidden infrastructure. We're talking about our intricate vascular and lymphatic plumbing systems. Think of them as a massive, high-speed highway network that literally keeps everything alive and moving. But what happens when the asphalt cracks, or the traffic backs up, or the drainage ditches get completely clogged, or, when rogue roadblocks suddenly appear? Anything from benign hemangiomas to highly malignant angiosarcomas. Today, we're going to explore the precise pathology behind exactly what happens when these crucial biological highways break down.
Okay, here is our roadmap for today's explainer. We'll be looking at 1. Normal blood vessel histology, 2. The 3 arteriosclerosis patterns, 3. Atherosclerosis, pathogenesis and risks, 4. Vasculitis, inflammation of vessels, and 5. Lymphatic vessels and lymphedema. Let's dive right in.
Section 1. Normal blood vessel histology. Before we can really understand the pathology, we've got to establish the healthy baseline of our highway system.
Take a look at the stark contrast here between the artery and the adjacent vein. Now, we all know blood vessels have 3 layers, right? The intima, the media, and the adventitia. But look at the incredible thickness of that middle layer, the tunica media, in the artery. It is absolutely packed with smooth muscle fibers. And this thickness is absolutely crucial because arteries need massive elasticity and contractility to withstand really high intraluminal blood pressure. Veins, on the other hand, just don't need this heavy-duty contractility, which is exactly why the vein in this histological cross-section looks almost deflated or kind of collapsed by comparison. Honestly, it's a bit like comparing a high-pressure fire hose to a wet noodle.
Section 2. The 3 arteriosclerosis patterns. Now that we know what healthy looks like, let's introduce our primary antagonist.
Let's start with a really basic definition just to set the stage. The term arteriosclerosis literally translates straight from its Greek roots. Arterio, meaning artery, and sclerosis, meaning hardening or thickening. So, arteriosclerosis is basically our overarching umbrella term for arterial wall thickening and that dangerous loss of elasticity we were just talking about.
And under this umbrella, there's a strict rule of 3. We have 3 very distinct patterns, and they each have entirely different clinical consequences. First up, arteriolosclerosis. Notice the extra O and L in there. This specifically targets the very small arteries and arterioles, and it is heavily linked to hypertension and diabetes. Second is Mönckeberg medial calcific sclerosis. This one is essentially a degenerative calcification in the muscular arteries, mostly seen in folks over 50. But here's the catch with Mönckeberg. It doesn't actually narrow the vessel lumen, so on its own it's not a huge clinical deal. And third, we have atherosclerosis. Now this is the big one. This pattern features lesions called atheromas that actively grow inward, aggressively narrowing the lumen and blocking traffic. And this is exactly what can eventually lead to severe complications like aneurysms, where that weakened vessel wall dangerously balloons outward.
Section 3. Atherosclerosis, pathogenesis, and risks. We're going to zoom in entirely on this specific pattern because it is by far the most frequent and the most lethal of the 3.
You can really see the vivid progression happening here. A normal, wide-open artery gets critically narrowed by a plaque. And when we look at the microscopic anatomy of that culprit, the atheroma, we see that the pathogenesis is driven by 2 main events: inflammation and the deposition of LDL cholesterol particles. The atheroma itself actually has 2 major structural components. On top, there's a firm, white, fibrous cap built out of proteins like collagen and smooth muscle cells. Beneath that cap, that's the necrotic center. Think of it as a cellular graveyard. It is literally packed with cholesterol crystals, calcium, and these lipid-engorged foam cells. It's just a massive pile of toxic debris buried right inside the artery wall.
So, what makes some of these plaques incredibly deadly while others just sit there? Well, it all boils down to vulnerable versus stable structure. A stable plaque has a relatively thin fat core and a thick, sturdy fibrous cap with minimal inflammation. It's locked down. But a vulnerable plaque? That is a ticking time bomb. It has a massive, thick fat core, high levels of inflammation, and a terrifyingly thin fibrous cap. If that thin cap suddenly ruptures, a superimposed thrombus, a blood clot, will immediately form, and that leads to a complete obstruction of the lumen, which means a sudden heart attack or stroke. No warning, just total blockage.
And what's driving the formation of these dangerous plaques in the first place? We divide the major risk factors into 2 main categories. First, the non-modifiable risks: age, genetics, and male gender.
Now, there's an incredibly fascinating detail from our sources regarding gender. Premenopausal women are actually remarkably protected against atherosclerosis compared to men of the exact same age, and that's primarily due to their high estrogen levels. But postmenopause, the second that estrogen drops, their risk shoots right back up to match men. Then we have the potentially modifiable risks, the ones you actually have some control over: hyperlipidemia, hypertension, cigarette smoking, and diabetes. These are the daily factors that actively injure your vascular lining and kickstart that whole inflammatory cascade.
Section 4. Vasculitis, inflammation of vessels. We are shifting gears now. While our highways can be physically blocked by plaque or hijacked by vascular tumors, vasculitis is an entirely different beast. This is when the highway walls themselves literally catch on fire with inflammation.
Vasculitis is this intense inflammation that causes aggressive wall destruction, and again, often results in those life-threatening aneurysms or severe stenosis. Because the forms of vasculitis are so wildly varied, medical professionals rely on the Chapel Hill consensus classification. This strictly categorizes the disease by the precise caliber of the vessel it attacks. So we have large vessel vasculitis, which hits the aorta and its primary branches, think Takayasu's or giant cell arteritis. Then there's medium vessel vasculitis, which attacks the main visceral arteries, like Kawasaki disease. And finally, small vessel vasculitis, which ravages the tiny arterioles and capillaries, like Wegener's or Churgstrass.
Now, diagnosing this is, well, frankly, it's incredibly tricky. Because vasculitis can easily disguise itself as an infection or even a neoplasia, doctors have to follow a rigorous step-by-step diagnostic journey to untangle it all. Step 1 is a deep clinical history, looking at medications, infectious risks, and autoimmune history. Step 2 requires highly specific lab tests, searching for markers like ANCA antibodies, which are a massive red flag for small and medium vessel involvement. Step 3 utilizes advanced imaging, like angio-CT or MRI, to actually visualize the vascular damage. It's basically a complex puzzle of ruling out secondary causes to find the primary inflammatory culprit.
Section 5. Lymphatic vessels and lymphedema. We spent a lot of time on the high-pressure arteries, but now let's look at the body's backup drainage ditches, the lymphatic system.
Let's track exactly what happens when the pressure in our lymphatic system just becomes too much to handle. A normal lymphatic collecting vessel has a very thin wall with just enough smooth muscle to pump fluid. But in lymphedema, as that fluid pressure constantly builds, the vessels have to structurally remodel. In the early stage, we see the ectasis type. The vessel dilates, the lumen stays open, but the wall thins out even more. As the disease progresses to the intermediate stage, we get the contraction type. Here, the smooth muscle cells desperately proliferate and thicken up to try and compensate for the load. But eventually, in the advanced stage, we hit the sclerosis type. The smooth muscle cells change state, massive amounts of collagen are deposited, and the vessel literally scars itself shut. The lumen becomes completely choked off, rendering that entire drainage system utterly useless.
So we've seen how incredible, and honestly how vulnerable, our internal plumbing system really is. From the heavy-duty muscle of our arteries, to the cholesterol-filled graveyards of atheromas, the unpredictable emergence of vascular tumors, the fiery destruction of vasculitis and aneurysms, all the way to the tragic scarring of our lymphatics. It is a lot. So I want to leave you with this provocative thought. Knowing exactly how inflammation and circulating lipids permanently remodel the walls of your vessels, how are your daily lifestyle choices actively rebuilding your very own microscopic highways right now? Thanks so much for joining me on this explainer. Keep learning, stay curious, and I'll catch you next time.